In particular, September the 10th is always one of those days that seems to be one of the high incidence days that you see hurricanes developing in the tropics. And it takes me back to 2004. We had 3 hurricanes within a 6-week period of time, Hurricanes Charlie, Jean, and Francis. We certainly hope we don't live through that experience again, but we are seeing in the tropics here within the area the development of additional hurricanes. In fact, in September, we are projected to record 6 named storms so far in 2020. There have been 17 named storms, not to mention a Category 4 hurricane that hit Louisiana, as you all are all familiar with. While Florida has been fortunate to avoid a major storm so far, we are not out of the woods yet. I just say to all of our public that we need to remain hurricane ready so that we can respond to whatever comes our way. The next named storms will be Sally and Teddy. Sally and Teddy. My goal this week remains on what we've said now for several weeks. We will continue to offer free testing to residents within Orange County. We will continue to offer financial relief to landlords and tenants and to residents of Orange County. And we will also continue to inspect and re-inspect county businesses to make sure they are operating in the safest manner possible. In terms of update on the numbers, our 2-week average is now 4.8% in terms of positivity rate. Remember, we said, and we've heard from Dr. Pino and other experts, epidemiologists, who said that if you can get to that 5% level or lower, you have effectively contained the virus within your community. So the fact that for the 2-week period we average about 4.8% is somewhat good news. We're going in the right direction. Our rolling average, however, is still over 11%. That's the cumulative rate. Since the beginning of the pandemic, Orange County has had a total of 37,247 COVID-19 cases. We had an increase of 94 just within the last 24 hours. But our last briefing was Thursday of last week, and since our last briefing, we've had an increase of 579 cases. We have now lost 387 residents to the coronavirus. That is an increase of 1 death since last Thursday. So 579 cases since last Thursday, 1 death. And each time I talk about the deaths, I want to make sure that we pay appropriate recognition to those who have lost a loved one, because they are not just numbers, and the fact that we have a family that has lost a loved one is still significant for our community. Our Orange County Health Services team has been busy today setting up for free COVID-19 testing for our residents who live in West Orange County. Starting tomorrow through Friday, free testing will be held at the George Bailey Park in Winter Garden from 8 a.m. to 1 p.m. Drive-ups and walk-ups are also welcome at that location. Among the community health centers, True Health at their Lake Underhill location is offering free options for walk-ins. That's True Health at the Lake Underhill location. The rest are offering tests to those who are symptomatic or if they are patients of the True Health centers. The county is funding True Health through the CARES Act monies that we receive from the federal government. We have 5 options throughout the county, and you can see the testing options through True Health by going to our website at ocfl.net/COVID-19. Next Monday, the Health Services team will be at the United Global Outreach Center located on 11th Avenue in the Bithlo area. Free tests will be performed along with the Clean the World mobile shower unit for the homeless population in that area. The event is scheduled from 1 p.m. to 5 p.m. for Monday, September the 14th. Now let's talk about our eviction diversion program. We are still accepting applications from landlords and tenants to help with overdue rent. Remember, landlords and tenants must agree to apply for the money together. So far, 419 landlords will be paid back rent through the program, preventing their tenants from being evicted. The average arrears of payments is now at about $2,900 for each household. Besides our Orange Cares Act money, which goes to assist those within our community, Orange County government is also helping nonprofits with programs that make an immediate impact. For example, Orange County government was awarded a community development block grant of a little over $570,000. We made that award to Habitat for Humanity of Greater Orlando and Osceola County. The monies are going to fund free roof repairs for those who qualify. With us being in the middle of hurricane season, it's important for people to get their roofs repaired if they cannot afford to do so. We are truly leveraging the CARES Act funding that we receive as a county to make certain that we're taking care of our Orange County residents. In order to qualify for the program, however, they have to meet certain criteria. That includes the individual must live in unincorporated Orange County. However, Orange County has interlocal agreements with some cities, such as Apopka and Winter Park, and you can apply if you live in those cities. Applications are still being accepted, and slots are available for the program. We have a total of 20 slots available, and currently there's been 14 people who have applied for assistance. So if you want to apply for that special assistance, you can go to Habitat Orlando Osceola, all one word, Habitat Orlando Osceola.org/repair my roof. Our business compliance or strike teams are in their second month of inspecting businesses throughout the county. Starting this Saturday, our teams will be out on the weekends inspecting businesses. So far, they have visited over 2,000. In fact, they've visited 2,027 businesses, and with an overall compliance rate of 93% who have complied with the directives that we have put in place. They have re-inspected 168 of those businesses. That means that initially when they went, they were not in compliance and they went back, and I think we have about an 83% compliance rate for those who are being re-inspected. We are currently visiting the larger theme parks. Earlier this month, we inspected SeaWorld, Aquatica, and Discovery Cove, and they passed with flying colors. We will be performing unannounced visits soon to the larger theme parks. I want to take some time, though, today to also talk about the need to complete the 2020 census. We have Ms. LaVon Williams, one of our managers for our census project here, so if you have any tough questions, save them for her. Our county has seen to date, at least as of September the 1st, a self-response rate of 62%. That's not good enough. That's far below our response rate of 72% in 2010 during the last census. So we really need to work to get the census documents completed. We need to increase the numbers here within Orange County because so much of the data that is collected directly affects how we are considered and how we compete for various pots of funding at the federal and the state level, how we draw our congressional district boundaries, et cetera. In fact, the $243.2 million in CARES Act money that our county received was a direct result of the census numbers that have been previously collected. It's a multi-billion-dollar impact on our community over the decade that it will be used to make decisions. Census officials have put 7 census kiosks in our county community centers. For those who may not have access to the internet, you can simply go to any of Orange County's neighborhood centers for families, and you can go in and for free. You can access the census application or the census documents online. We have staff that's been trained who are there at those centers who can assist you with the process. The community centers are open Monday through Friday from 8:30 a.m. to 5 p.m. They are the East Orange Neighborhood Centers for Family, the Hal P. Marston, Holden Heights, John Bridges, Maxey, Taft, and Pine Hills Community Centers. If you haven't completed the census, please take the survey now by going to 2020census.gov. 2020census.gov. We want to make certain that every one of our residents are counted here within Orange County, and we will be doing outreach with the clergy here within Orange County to try to get those numbers up. We want to surpass the 2010 census numbers. At that time, we had 72% participation. We want to surpass that, and we only have just till the end of this month in order to get it done. So whatever you, the media, can do, or others in our community can do to assist us in getting the word out and encouraging people to complete the census, we certainly would appreciate it. And with that, I'm going to turn it over to Dr. Raul Pino from the Florida Department of Health at Orange County.
Good afternoon, everyone. Thank you, Mayor. Thank you for the press for being here. We have a few things that we'd like to share with you. As the Mayor mentioned, we have a total number of cases accumulative of 37,247. That gave us 11.5% positive rate accumulative. And our recovery rate for today is 96%. That is 93% on August 20, 94% on August 24th, 95% on August 27th. Today is a 96%. And that goes in line with what the mayor was saying about controlling the pandemic into the county. And we have been here before. And so I want to give some signs of alert to individuals. But before that, also to address the issue that we have added an additional death was reported to the Department of Health, and one is too many. But you may remember the times where we were reporting 20, 34, 12, and this is the last of the indicators to come into compliance, if we want to call it somehow. The person was 92 years old, a female, Caucasian, with underlying conditions, and from an assisted living facility. We also, although our numbers continue to decrease in all levels, I want to call our attention to a slight increase in the age group between 15 and 24. And that also applies to 5 years old to 24 years old. It all depends how we slice the data. It's not a significant increase. Our total number of cases have decreased, but as we watch for age and social activities that we have increased, that mean colleges, universities, and schools, we're also monitoring that age group closely. So it's a small increase, not unexpected, but it's an important fact to take into consideration that these individuals in this age group are very socially active, and us as adults, as much as we can, we should influence them to follow CDC protocols and procedures at home and outside of the house. So wash your hands, wash your distance, and wear your mask are critical to keep this pandemic under control in our county. You also saw the news about a closure of one of our schools, high school in Olympia. The board at some point probably will give you more information on what went into the decision-making process. But it was not due to secondary transmission of the virus in the school. It was really done out of abundance of caution because through our trace investigation, we have determined that there was a high school, a birthday party that 13 of the kids from Olympia High School attended on August 29th. It could be that it's more than 13, but that's the number that we are working right now. Based on the experience of other counties around the country where this type of what some people call super spreading events occurred, I think that have played a role in the decision-making from the board. We also have moved a testing unit into the high school. They are doing testing right now in the gym, and they will be there also tomorrow from 2 to 7 today, from 2 to 7 p.m. tomorrow, so that parents and students and workers have a choice. It's not supposed to be mandatory. It's not the testing. People can go tested whatever they want to, and some people may not even want to be tested, and that's absolutely fine. But we are offering that as a resource that individual may have for the school population and the employees as well. There were also possibly 2 other students from other 2 high schools that have attended this party, and that continued to be an investigation. It's an open investigation that we will continue to carry out. I also want to encourage people to get flu vaccinations for the season. Influenza season is coming, and the least of the concerns that you want to have is to have an undetermined condition that could be either flu or COVID-19 as they, mimic to a degree. We also have recently been working with UCF. There are several sorority houses outside of campus that we have detected some cases, and at least 2 of the houses has been placed on quarantine. The number can continue to increase. It could be up to 5 of those houses, and that will include the residents and the staff that work in some of those houses, as well as some visitors and some activities, social activities that the students are taking on. And this is the scenario that we don't want to repeat. And this is what we didn't learn 3-4 months ago. It is that it is important for everyone in our society to carry those preventive measures. For those people who are mostly asymptomatic, who will have a positive health outcome, I want to remind you that we went from 50 individuals dead to 387 today. That's a huge jump. And those deaths are the ones that we are going to be prevented by following CDC guidelines. With that, I will answer any questions that I may have. Mayor, back to you.
Okay, we do have Mr. Scott Howard here from the Orange County Public Schools. If there are questions specific to the school district, we also have Commissioners Gomez Cordero and Commissioner Uribe who are here, and if there are any questions in Spanish that need to be responded to in Spanish, we have Ms. Ilia Torres, one of my special assistants who can help translate, and of course Dr. Pino is bilingual as well. And so with that, we will open it up for any questions that you may have.
Well, you got it too.
Guess so. Thank you. Lauren Seabrook, Channel 9. Mayor, I have one for you and one for Dr. Pino today. Starting with you, if you could just tell us kind of what went into the decision to have the strike teams working on the weekend. We've done some stories with some of the bars/restaurants that have had long lines and people maybe complaining that there weren't doing the right thing over the weekends. Did that play into it, or could you tell us about that?
Yes, because of the nature of some of the complaints that we have received, we wanted to make certain that we were out in the community doing the enforcement and the inspections when we truly need to be there. And sometimes, I can tell you from my law enforcement days, yeah, you know, we didn't take days off, and if you were involved in unlawful behavior, you had to understand that we could come out anytime. And so with the strike teams, something similar. What we're saying here is that 7 days a week, we will be vigilant in doing the inspections and enforcement. And one more she had for Dr.
Oh,
Pino.
you can take it away from her, don't.
And so just wanted to clarify with you on the birthday parties, I think you said the number 13. Was that 13 kids who tested positive were at this party, or 13 total at the party? And just what would you want to say to parents who may be planning birthday parties for their own kids?
So there are 13 kids that we know that attended the party from Olympia High School. The party could be larger than 13. There are some numbers of about 200 people. I don't know if that's real. Again, we are in the process of determining all these. And we are dealing with the students in the sense that, of course, they are afraid of the consequences. So talking to them becomes a challenge in the sense that out of fear, they probably will be hiding some information from us. So we interview parents as well. Scott could talk about the number of positive individuals that are coming out of that party. But again, I expect that number possibly to increase. And the advice to the parents is we have to be forceful with our children. I have to. And at sometimes when they are 16, 17, 18, they make their own judgment and decision. But we have talked also about the fact that in household where you have intergenerational living, there are older adults. These individuals, not just the students, but anyone who is in and out of the house, is also interacting with the community back and forth, and possibly asymptomatically bringing the virus into your household. So these measures, these preventive measures apply to everyone. And it's say, even at 5% that we are, it is safe to assume, and we should assume, that everyone has this. And there are consequences of our actions. And for example, the board have to move an entire school into quarantine and distance learning because of a birthday party. So we should have also keep in mind our independent and individual actions, what kind of impact has in the community at large. And those are things that we should keep in mind and educate our children also, that their individual actions sometimes has community consequences.
Steve Hudak from the Sentinel. This is for Mayor Demings. On Friday, the governor tweeted out, I guess, a notice to all 67 counties. He wanted to know what executive orders you'd signed for, not just for the county, but for any other boards you might sit on. I'm assuming that you received a letter from them. Despina had said earlier that they hadn't received anything. The governor has not communicated very well with Central Florida throughout this whole pandemic. We've documented that in the past. Do you have any idea what he's looking for? And are you prepared to kind of stand your ground if he says, look, you can't be any more strict than what I tell you to be in the next phase if we get there? That's a real long question, I know. Sorry.
To my knowledge, we have not specifically received written correspondence from the governor's office. So that could change, hour by hour, but before it actually hits my desk. But at this point, to my knowledge, we hadn't received formal communication. But we are aware of the governor's request for each of the counties to provide information about executive orders or other decisions that have been made. We will comply with that. I do not know the governor's motive for making the request, but if I were governor, I'd want to know what is happening throughout the state of Florida, and perhaps they should already know that, because we have an emergency operations center that has been active since March, and we do communicate daily, sometimes many times a day, with the Florida Department of Emergency Management. And so I would assume that they should already have the information that is being requested, but perhaps he's trying to better understand what is going on. I hope that the governor's intent is not to further diminish the authority of local governments. After all, as we respond to this pandemic, it happens in our neighborhoods, in our cities, in our counties. And so we have to have the ability to react and respond to the pandemic real time based upon what we are seeing here in our unique locations. And so through our advocacy with the Florida Association of Counties and other organizations, our advocacy is that local governments need to have authority to make local decisions. Yeah. Okay.
Eric Sandoval with News 6. Question for Dr. Pino. We're talking about a birthday party attended by some students. Soon we're going to have fall sports kicking off too. What are your feelings on the safeguards being put into place with the upcoming seasons coming up? And do you think they're enough, or do you think we're going to be in the same boat with the increased numbers again?
With regard to sports, there were some recommendations from the medical advisory board to the school board into kind of stagger and corral, especially the football players, because of the high contact sport that it is. And there were some discussions about including other sports. And in this case, and Scott is here, he could talk better, but I believe that the football players were placed on distance learning. They would be tested prior to playing to without, if you want to call it that way, someone that may become positive at the time before playing. And with that, to decrease the possibility of exposure for some of the players. The medical board, the medical advisory board was also advising into looking into other sports that may have high contact. But I don't know where that is at. I believe there's another meeting this week, and maybe that will be part of the discussion.
What about for spectators? For spectators?
Spectators. So it depends. We don't have to authorize any of that, but we have engaged with whoever wants to. And we have looked at their floor plans. And for example, we did it with UCF. We look at the floor plan of the stadium, make some recommendations, and they took all our recommendations. And those were, for example, not to have tailgating parties, to color-coded the city in charge and make it correspond with color-coded parking areas and stagger the entrance and exit, and some steps that you can take. And this is kind of a social experiment in the sense that we have to move forward, but at speed and caution that will allow us to stop if we see that things are not going the right way. With the soccer stadium for the Orlando team, it's the same. We visited, we made some recommendations, and they took on, and we hope that people follow. But the best vaccine that we have right now is the mask. You have your mask on, you are protected. You are 6 times less likely to acquire the disease. So it's significant decrease of exposure by wearing a mask.
Chris Gordaro, West News. This question is for Dr. Pino as well. Can you just take us through the process of how the contact tracers determined that a birthday party may be responsible for the Olympia High outbreak? Did they interview people? How did they do it?
So contact tracing is a conversation that you have with the individual. Although you have kind of general script that you know what you are going to ask, it's also where the conversation, takes you. And some of the students mentioned that they have attended a birthday party. We believe that at that birthday party was also a student whose parents were positive at home. We haven't been able to establish that for sure. So those are lines that we are tracing. And in this case, we will test additional individuals to see if you can establish. But this is about a correlation between place, space, and diagnosis. And then when you have this number of cases converting into a place, and you have this number of exposure, and about also what we know, about 50% of the people that may have been exposed are positive right now. So that is a significant coincidence about that place and that space where those people were at the same time. So it's an inference more than a determined this was the place. But it's safe to assume that that was the case.
Hi, Megan Cruz from Channel 9. Hey, Dr. Pino. Can I ask you to walk us through a little bit more of the UCF sorority houses case? Like how many members actually tested positive versus how many were actually quarantined? And then in your contact tracing, did you guys determine that those who might need to be quarantined were outside of the sorority houses, maybe came into contact in a classroom or something?
I can really talk, I really don't know those numbers yet because they are very preliminary. I believe there are some contradiction between us and the numbers that we are seeing in the lab results. So we are waiting for that to clear. I believe that is up to 5 houses. Some of the communication from the school says 2. Some of these houses also have maids and chefs and people who do some errands for the housing. So we have to go and investigate those individuals as well. We know that it's an area at the end of the road that is kind of a playground area where some sports have taken place. So we have to investigate that too. So it's too early for us to give you a concise number, but the school may have better information on that.
Hi, Emily Braun with News 13. This is for Dr. Pino. So you mentioned the slight increase in the age group that you mentioned, about 15 to 24, right? Is that what you said?
Yes.
So obviously there's, a big group of that that's high school age. There's a big group of that that's college aged. Is there a group between those two that you feel more concerned about than the other? And how do you think, parents or educators can really break that message through to that age group?
So we detected that increase today when we were analyzing the data. So more analytics have to happen to be precise of what is happening and where it's happening. But I want to make emphasis on one thing, is that some of the cases, all of the cases that are related to Olympia and other schools have been acquired, as far as we know, outside of the school setting. And that places a lot of emphasis on what happened in our community and our question, how can we educate our children into wearing masks and taking these protective steps? And we learn by imitation. So by parenting that behavior and educating our children in protective measures is the only way that we are going to achieve that. And we cannot have a double message. We cannot be asking our children to wear masks if you are not wearing a mask, because they learn by imitating. And it will be important, and even for those who are younger, for parents and members of the family to start favoring those behaviors, even in settings where may not be needed, but we need to practice in a way that you may feel unsafe, but not having your mask on it. Like you notice that you're missing your mask. The same way that our kids notice that they don't have their phone in their hands, and they are crazy looking for that phone. And that's the behavior that we want to imitate.
This next question was texted in for Dr. Pino from Annie Martin with the Orlando Sentinel. Additional to, I'm guessing, this sorority situation, Dr. Pino, could you address anything the department has seen as far as increase in COVID cases in the areas surrounding UCF's main campus during the past couple weeks?
Well, there has been an increase because of these cases that I'm talking to you. We haven't done analytics again. This was a development over the weekend. So with time, a little bit over this week, we could be able to map it out and realize if anything is happening surrounding UCF, but it's too early for that type of analysis.
Additionally, this next question came from Gabrielle Rousseau from Orlando Sentinel. Dr. Pino, there were reports of larger crowds at the theme parks over Labor Day weekend. Are there any COVID cases connected to this past weekend, or is it too early to know? And if it is too early, when might we know if visitors and theme park employees have tested positive from this Labor Day weekend?
So we have said before, it's not that we haven't had cases in the parks. It's that we haven't had an outbreak that we can identify in the parks. So it's too early. There was an increase. It was a long weekend. It was a holiday weekend. We had conversation with some of the parks prior to the weekend to, emphasize on the steps that they are taking. And so far, we haven't been able to identify any outbreaks. It is too early to know if something would have been related to this weekend. That probably would be late next week.
Dr. Pino, this next one was texted in from Sierra Putman with WFTV. Dr. Pino, this is in regards to the testing at the school, I believe Olympia High School. Which type of test is being used and why? And if there was no sign of in-school spread at Olympia High School, why close with just 6 people testing positive?
So those are all good questions. Regarding to the closure and what they decide to close, that was a decision by the board, and the board can answer that question. Now, 6 cases, just to give you a perspective, and again, transmission was not the reason, but 6 cases is a lot of cases. In the sense that you have 6 today, you allow those cases to go into an environment, you may have 20 tomorrow, and then after that you have 60, and then it goes out of control. And that's what we don't want to. And the board can answer the question with regard to why they decided to close.
Scott?
Thank you. Thank you, Mayor. Thank you, Dr. Pino. The decision to close really wasn't around the number of cases, although it was a few that we were concerned about. It's really around the 156 quarantines and the numbers of staff included in that and the ability to safely continue to operate, knowing that there may be cases within the quarantines as well. So out of just the safety of our students and staff to go ahead and pivot, we've been preparing for this. We did 9 days of launch ed prior. We knew that a school closure at some point was going to happen, and we were prepared. Our students were prepared, and right now they're learning the same way as they did for the first 9 days of school. So it gave us a good opportunity there and a great way for us to continue to make sure that they didn't lose anything in their education in the process. So,
Scott, if I may add also, it was a good exercise. It was a good exercise for us as a health department and the board, an ability to communicate through a holiday weekend, and the ability for the department to set up testing in 48 hours since we decided to set it up, move into the location, bring the staff and the testing. We are using PCR testing because it's the confirmatory test, and it should be between 24 to 48 hours for results.
Thank you both. Dr. Pino, this is your last question from me, text in from Ganara Alvarado from El Sentinel. The question is, we are almost into flu season. What is the biggest concern now that there are cases of coronavirus? What should people know and do to protect themselves? If you could answer this question in both English and Spanish, please.
Yeah, so we need to vaccinate for the flu. The flu causes about 60,000 deaths every year. And we have about over 180,000 already from the coronavirus. So as much as we can, we should prevent people from dying for preventive preventable conditions. And the flu is one of the vaccines that we don't have a good uptake because people have concerns about is it worth it, is it effective, and you have to take it every year, and all those inconveniences. But if there is a year to get vaccinated for the flu, this is the year. Especially if you have pre-existing conditions, you are elderly, and you have clear with your provider that the vaccine is safe for you.
In Spanish.
Oh, en Spanish. So, la pregunta fue, ¿qué deben hacer las personas? ¿Cuáles son las recomendaciones con respecto a esta estación de la gripe que viene ahora en el otoño? Y el consejo que le damos a todos es, por favor, vacúnense contra la influenza. Sabemos que hay preocupaciones si la vacuna es efectiva, si no es efectiva, algunos años es más que otro, hay que ponérsela todos los años, pero si hay un año que necesitamos vacunarnos, es este. Si no se vacunan los años próximos, pero este año hay que vacunarse. Imagínate que el flu produce alrededor de 60,000 muertes al año y tenemos más de 180,000 ya en esta pandemia. Pues entonces sería significativamente importante para proteger a todas las personas que podamos contra la influenza. Si el médico dice que está bien, que la puedes tener, si tienes más de 65 años, si tienes alguna condición persistente, deberían ponerse la vacuna.
Question comes in from Ryan Lynch with the Orlando Business Journal. Mayor, have the major theme parks been visited by the strike teams yet? Which you mentioned, I think he wants more specific. And what will happen to the businesses that are in non-compliance on a second visit? Is this 3 strikes and you're out?
We have not established a 3 strikes rule and you're out, but depending upon, I think, the severity of the infraction, it could be punitive, could be criminal infraction. But those are all possibilities. In terms of have the major theme parks been visited at this point, remember we like to have surprise visits, and if they have not been visited, they will be visited. And so I'll leave it at that. Okay. And if that's the last question, like clockwork, Lauren always asks the first question, and Ryan always asks the last question. If there are no questions, Commissioner Gomez-Cordero is here, and she's willing to take any tough questions along with Commissioner Uribe. Okay, I guess you all are off the hook then today. Thank you all for joining us, and we'll see you at the next press conference, I believe is Thursday. Thank you.